Topic is orthopantomogram. Dear students, we'll discuss image today, plain X-ray, but look at this. So what is this image is? See that in a line, a single line, you can see the mandible here. You can see the dentition very properly. You can see the mandible tables properly. Entire length. What is this image is? This is orthopantomogram X-ray, OPG. What is this? The plain X-ray of the mandible, where an entire mandible is in a single plane. It's important. It highlights better in relation to dentition, inner and outer plates. The indications are jaw tumors, fracture, secondary metastatic spread from the oral malignancy, mandibular thickening can occur, tenderness, thickening, irregularity, fracture site. These are the four components, clinical features we look for in oral malignancy, whether a mandible is involved or not. So this is assessed by orthopantomogram tool. Currently, CT and MRI gives a very detailed research, but it's a good old method, still very useful. Osteomyelitis of the mandible, dentition assessment. See that dentition assessment. Very clearly you can assess. Fracture site you can find out. Carcinoma oral cavity infiltrating in the mandible, I already told. Clinical features I have told. So the indications for orthopantomogram, we should be able to identify such patients. Dental tumors, jaw tumors, adamantinoma, dental cyst, dentigerous cyst, different dental tumors, osteoclastoma of the mandible. All these things can be very well assessed by this, of course. Now, CT image, reconstructed images are, and which is very, very useful to identify any problems. It's a good old method, plain X-ray. It's a plain X-ray, remember. It's not a contrast X-ray in MCQ, remember. It's a plain X-ray in a single plane. That point you have to always remember. Where patient rests like this, machine rotates like this. There is a jaw rest is there. Machine rotates like that, if you have seen. So, answer the MCQ. Noma is gangrenous hemorrhoides, gangrenous appendicitis, gangrenous stomatitis, gangrenous cholecystitis. Find out the right answer. So what this image study shows: enhancing lesion in the right adrenal gland, enhancing retroperitoneal lymph nodes, enhancing lesion in the head of the pancreas, enhancing lesion in the transverse process. Find out. So CT scan is invented by Godfrey Hounsfield, William Halstead, Roentgen, Egas Moniz. Again, find out and give the right answers for these MCQs. I'll get back to you later. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic. And principles of examination is good, and differential diagnosis in the table format is given, and briefly investigations. Suppose treatment is not a topic will be covered in a clinical method examination, remember, and many photos of the most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos. And it also gives the instruments, specimens, then operative surgery briefly, everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB's manual of surgery is very popular. It covers theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations and used worldwide also, actually, including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB's Operative Surgery Atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything with total around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by-step technical aspect. Very, very useful for postgraduates. They're not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book and memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step-by-step with illustrations. And my SRB's Atlas of Tissue Approach, small book, Atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. it is covered. So any basic learners, suturing is very, very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with the videos. You can always go through that. And my website, please subscribe, all of you. Your daily lectures are there, live sessions are there. My DigiNower lecture through JP Publishers, around 220 hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.